People normally associate baldness with middle-aged men, but a surprising number of women also have varying degrees of hair loss. Recently I caught up with one woman who's turned to a technique called micrografting, which some feel gives the most natural look in hair replacement. When Rosalie Frost goes to the hairdresser, the last thing on her mind is a cut. She prefers to leave the salon looking like she has more hair than what she started with.
And got a bald spot there, so I just need to try and get a style to cover that up.
Rosalie was left with an 8-centimetre bald patch after having a cancerous lump removed from the top of her head 6 years ago. Since then, she's always had to fuss over her hair.
Constantly covering it up. If it's not to go to work or just to even just go up the street of a morning, you need to do something with your hair before you go.
So Rosalie's decided to cover it permanently.
What I hope to achieve is to not have that look.
After seeing our story on Good Medicine a couple of seasons ago about a new transplant treatment called micrografting, Rosalie decided to try it for herself. Now, it's more labour intensive than most techniques, but it promises results without the need for sedation or the scalpel.
It's a fairly extensive bald area and there's a lot of scar tissue in it, okay? But I do believe that we can get reasonable coverage.
The micrografting technique takes individual follicles straight from the scalp. This involves making micro-incisions in the donor area without the need for stitches afterwards.
Okay, Rosalie, I'm just taking out your follicles now, as you see.
Rosalie remains conscious while Dr. Woods uses local anaesthetic to carefully remove about 400 hair follicles. The transplant involves punching tiny holes into the bald patch using a hypodermic needle and dropping the follicles in. After a marathon 8 hours, Rosalie is ready to check out her new tufts of hair.
Oh, wow.
Looks great, doesn't it?
Yeah, it's like it's got hair there already.
That's right.
It really looks like stubble, doesn't it? Like, yeah, like a beard.
Rosalie will need one more grafting session, then she'll have to wait a little longer than normal for her new hair to grow because of her cancer operation. But she should see some good results in about 6 months. And half a year down the track, we decided to put Rosalie's new head of hair to the test on a windy day on the Manly Ferry.
Like before, I'd be probably walking along like this, going like that just in case someone saw it. So, yeah.
Now you're celebrating being in the wind.
I didn't think it'd work like it did because of the scarring I had, and I was told that it would never grow. I didn't think it would ever have hair up there, so yeah, it's fantastic.